Vinay?
Yes, hi.
Hi Vinay, I'm Ninu. I'm a radiation therapy student here. How are you feeling today?
I'm alright. How are you feeling today?
I'm good, thank you for asking. So, I'll be giving you a brief overview of the simulation process today and help answer any questions or concerns you might have. So, before we begin, I'm just going to do an identification process with you.
Yes.
So, can I please confirm your full name and date of birth?
Alright, my full name is Vinay Varghese. My date of birth is 8th of March 2002.
That's good. Can I also get your address, please?
My address is XYZ NSW Wollongong 2500.
All right, that's good. And you're here for prostate treatment?
Yes, I am. That sounds right.
All right. Vinay, have you ever had a CT scan taken before?
No, I haven't, but I'm really curious to know what the process is like.
So the CT scanner is just like a rotating X-ray machine. It's shaped like a donut and it takes images from different angles. So it helps us get the size, location, and spread of the tumor. And from that scans, we'll be able to draw a treatment plan for your radiation therapy treatment. Yeah.
Wow, that sounds really good. Are there any other alternatives to this CT scan?
So another alternative is getting an MRI scan, but with the MRI, it sometimes take a little bit longer time. And for prostate treatment, CT scanner is much more reasonable option.
Alright, that sounds really good.
So you'll be all right to go ahead with that?
Yes, I am. Yes, I am.
All right. So I just want to ask you one more thing. Have you opened your bowels today?
Yes, I did.
And you got a full bladder?
Yes, I am. Yes.
All right. So what we're gonna do now is, I'll get you to change into the treatment gown, and you'll have to take out any metal jewelry or any objects you have on your body. Just want to confirm one more thing. Do you have like a pacemaker or a metal prosthetics on your body?
No, none that I am aware of.
All right. Just because the metals alter the CT scan a little bit, so we don't want anything that sort to happen.
Yeah.
All right. After you change into the gown, we'll take you to the room. There'll be two staff with you, and we'll assist you onto the treatment table. The table can be a bit hard to lay on, but you'll be asked to lay on your back with your arms raised above your head, and we'll try to make you as comfortable as we can on the table. Yeah.
Yep.
And do you have any problems with lying like that?
No, I'm feeling all right, so it should be okay.
All right. Once you settle on the table, we might use some immobilization devices just to ensure that there is no patient movement.
Okay.
Yeah. And you know what? When you come for the radiation therapy treatment, we need the same positioning as now, just because the treatment plan is based on this positioning.
Okay.
Yeah. So what we'll do is we'll record this positioning, and for this we might take some measurements, take some photos, and we might also use some very small permanent markers on your body, which we call tattoos.
Okay.
So do you consent to all of this?
Yeah, it all sounds good for now. Yeah.
All right. Yeah. So after that, after all that's done, we'll exit the room, and we'll go to the control room, and we'll be able to monitor you from there, and talk to you, communicate to you from there.
Okay.
Yeah. So if you have any problems, like at all, like just let us know, and we'll come as soon as we can to help you.
All right. So when I'm in the room, there's nobody else going to be there in there, yeah?
Yeah, you'll be there alone.
Okay. So if in case I do need some help or I feel uncomfortable because I'm a bit claustrophobic,
Uh-huh.
what should I be doing then?
So just let us know, because you can actually talk to us. So if you're feeling uncomfortable, like we'll come back to your room. We'll come back to you like after we make sure that it's like all the necessary precautions done, because we don't want any radiation hazard for anyone else as well.
All right. That sounds really wonderful. Okay.
Yeah. So do you have any other doubts or concerns?
Another doubt is if are there any harmful side effects to this procedure?
Because we're using X-rays, there is and X-rays are ionizing radiation, so there is a radiation risk, but the exposure is very low and not that harmful as well.
Okay, that's really nice to hear. Also, how long will this procedure take? Will it take a long time or?
So the procedure is gonna be like 30 to 45 minutes because it's your first time in here. But from next time, it won't be as long as this one. And after the procedure is done, we'll come assist you out of the table as well. And a healthcare expert will be able to explain to you about any aftercare process as well.
Right, that sounds really lovely. I think I'm ready for the procedure if you are.
All right. Yeah. So I'll give you these consent forms to sign. Just make sure you read through all the clauses in it.
All right, thank you so much for your help. I'll see you soon.